Much of the report builds on the strategies that have become part of everyday life over the last year. WGN's Brona Tumulty joins us now with more details. Brona.
Good evening, guys. Yeah, the guidelines are a roadmap of sorts. One of the doctors here at Lurie Children's Hospital telling us today it's kind of a framework for schools to get an in-person learning going again for those who've yet to do so.
Schools can be safely opened only if all of these things can be done.
Dr. Larry Kosiolek of Lurie Children's Hospital is talking about the updated guidelines for schools released today by the CDC.
Schools were using tried and true methods for reducing risk of COVID. And so for that reason, it shouldn't be a surprise that there's not a risk mitigation strategy in there that's brand new.
A lot of the mitigation measures mentioned are things we should all be well accustomed to by now, including how schools should implement and prioritise the likes of proper mask wearing and social distancing, with suggestions on doing so, including breaking groups of students up into small pods and staggering schedules.
What is important for one school and what is safe for one school may not be safe for another. Schools were really lacking a framework for how much COVID is too much and how to mindfully pivot.
The report also states vaccines for teachers and staff should be administered as soon as supply allows, but are not a prerequisite for getting the doors open.
We've known for the last year that essential industries like hospitals and schools can be safely opened with other risk mitigation strategies.
Something President Joe Biden has pledged to do in some capacity for most schools around the country within his first 100 days in office.
To being able to make sure that they're able to get kids back in schools and what role the federal government should play in helping getting that done.
The issue of when it is safe to open is also addressed, with the CDC advising schools to look at the total number of new cases per 100,000 people over a 7-day period, along with the percentage of positive tests, and outlining what schools could do depending on low, moderate, substantial and high levels of COVID-19 transmission in their communities.
They define those in more detail, and most importantly, what they contribute is providing some metrics for gauging community transmission to allow schools to have some guidance for how to pivot in their phased reopening plan based on risk in the community.
Now, per that table there from the CDC, anything below 50 new cases per 100,000 people and below an 8% positivity rate is considered low or moderate transmission, which under their recommendations will allow for full in-person learning across all grade levels. Now, the full report is about 35 pages long. If you want to read the whole thing, it's going to be on our website under this story at WGNTV.com. Outside Lurie Children's Hospital, Brona Tumulty, WGN News.